So a lot of students' main complaint is, okay, we learned how to do evaluation and special tests and all that stuff, and we get to the diagnosis, and then we have this big gap between what we got out of the evaluation and what we're going to do with our treatment, and it doesn't make any sense. So here's why that is happening. The way you were taught to do evaluations was to evaluate symptoms, then give the symptoms a fancy name for a diagnosis, and then you're supposed to follow a protocol or some kind of conventional line of thinking as to how you treat this diagnosis, which, if we reverse, the diagnosis is nothing but symptoms. So when you are doing special tests, you're trying to get to a diagnosis. When you are doing girth measurements, you are assessing symptoms. When you do a pain scale, you're assessing symptoms. When you do manual muscle tests, you're assessing symptoms and their ability to compensate. None of that stuff is going to get you to the root cause, which is why you have this big gap in between what you're doing with your assessments and what you're trying to get to with your treatments. So what we have to do is fix your assessment first. So your assessment should be focused really briefly on letting the patient let you know what the mechanism of injury was, what they've been trying to do for it since then, what it feels like today, what they can't do, what they can do, what they want to be able to do, really fast. Don't go into, is the pain tingling, or is it numb, or is it this, or is it that? Because as soon as you go to talking about symptoms, namely pain, now they think they're coming to you to get rid of their pain. Now you've already set yourself up to lose, because now you're chasing symptoms. And you can get pain to go away, so you've figured this out. So physical therapists and PT students have figured out that you can bring the pain level down with E-stem and ultrasound and tape and massage and stretching and foam rolling and all the garbage for a short amount of time. You're not going to get long-term results, and oftentimes you're going to get decreased results long-term because what you did in the short term actually made them worse. So I tell patients this all the time. So when they come to see us from a previous physical therapist, chiropractor, massage therapist, I say, well, and they get up and they're like, oh man, I feel fantastic and blah, 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 blah. But, I felt good after the last PT for an hour. And that's when I tell them, well, here's the problem. You went into PT with an issue. You came out of PT with more issues because what they did to cover up your symptoms actually made you worse on a physiological level, which is why your symptoms came back and which is why you keep going back 2 to 3 times a week for 6 to 8 weeks. So that whole mess is directly due to not getting to the root cause in your assessment. So spending too much time talking about pain, letting them think that they're coming in for pain or swelling or stiffness or weakness or whatever their symptom is. Stop talking about that. Ask them the pertinent information. How did this happen? What can't you do? When do you feel symptoms? What have you tried to do for it lately? Those types of things. Then we're on to assessment. And assessment should be, the first thing you should be doing is watching them move. Total body screen, shoes off, no braces, no tape, no garbage. Watch them move without any external support and see where they fail. Okay? So if you're not watching them move and you don't understand why they have pain or lack of range of motion or weakness or stiffness or whatever at a specific angle of what they are doing, then you can't get to a treatment. So there's the big dysfunctional gap that school left you with. You don't know how to assess function. When you do assess the function, you don't know how to analytically whittle that down to, here's what the problem is. Is this an eccentric contraction, concentric contraction? Is this lack of pronation? Is this lack of pronation control? Is this, you don't understand how to do that stuff. So then you can't come up with a treatment that's worth a crap. All right. So once you get there, little subjective, once you go through a full total body screen, watching them function, where they fail, and understanding why they fail when they fail, and getting that done in less than a minute. So we're not doing the SFM, FSA, whatever screen for 45 minutes to an hour, because all that does is get you to a diagnosis. and then you go do your treatment plan protocol. So I have no idea why anybody would do the SFMA, SFFMS, whatever the hell it's called. I went to that course for 2 days, and it was the biggest waste of time of all time, because all they do is dump you back into the dysfunctional model. You don't learn anything about why that person is failing that screen. So you have to be able to understand how different people move, because nobody's going to be the same. If you have 10 people come in with plantar fasciitis or patellofemoral syndrome or idiopathic low back pain, all 10 of them are going to have a different presentation once you get down to the root cause. They're going to have similarities, but they're all going to be different. So that's why if you just throw them into a protocol, 10% will do well with the protocol. They won't do phenomenal. They'll still have to come in twice a week for 6 to 8 weeks or whatever, but at least they'll progress slowly. The other 90% won't progress at all because the protocol totally missed what the problem is, because you never got to what the problem is. All right. So the number one reason why you are frustrated and why you're failing with going from eval to treatment is because your eval is completely wrong and takes you down the wrong road. So then you're just grabbing for straws. So here's what people tell me. Well, I get done with my eval and then I don't know, like, should I do stretching with them, or should I do myofascial release? Or should I do corrective exercises with them? Or should I do some other exercise, something else? Should I do cupping or needling? Should I put them in orthotics, or should I do K-tape? Everything that I just listed there is a symptom modification gimmick that's not going to get you anywhere. Because they're going to come in and say, I felt better for a half an hour, and then everything came back, and then you're back reaching for straws. So what we're going to talk about in our Facebook Live coming up is going to be how to quickly get to the root cause of the problem in your assessment, so that when you go from assessment to treatment, it feeds directly into the treatment. Your assessment and your treatment should be meshed together. So you should be going back and forth from assessment to treatment the entire time you're working on them. It's not, I ask them questions here, then I do objective measures here, and then I do a treatment here, and then I send them home here. That's why patients fail, because of that compartmentalized thinking. Everything should mesh together and run a smooth, steady line. Okay. So next week, we're going to do a Facebook Live. And last time I looked, you guys want Facebook Lives to be on Wednesday. So look down in the poll down below and make sure you vote. So I put the Facebook Live on the day that you want it. I'm going to release the date of Facebook Live tomorrow afternoon. So make sure you vote between now and tomorrow afternoon, so I can get the day that you guys want. And we're going to go over how you quickly get the information that you need that meshes directly with the objective assessment that you are going to do, which gets you directly to the root cause, which takes you directly to the treatment, which takes you directly to the therapeutic exercise, which takes you directly to the patient education. Everything works together instead of compartmentalized crap that gives you nothing but frustration and gives your patients frustration too. So get down below, make sure you vote for the day that you want. Then when I release that date next week, it will be at 5 o'clock my time, which is 7 o'clock Eastern Standard Time, and it's 4 o'clock California time. And for you people overseas, it's way off time, so maybe you'll watch the recording. I will record it and post it on Facebook. So just make sure you vote, and then make sure once I release that date tomorrow, you put that on your calendar so you can be there, and we can take a half an hour to 45 minutes to go through this instead of 7 minutes here. Talk to you then.